Should I start? Good morning, everyone. Good afternoon if you're not in East Africa, or good evening. I would like to welcome you all. Thank you for joining the South Sudan Women Intellectuals Forum. My name is Dr. Juliana Ball, and I will be moderating this session, which will be discussing mental health, suicide risk, and prevention among South Sudanese. I hold a PhD in public health. However, my field is in health system strengthening, so this is not my area of speciality. But we do have a panel of subject matter experts who will take us through this discussion. Wanted to note that we have two mental health therapists on the panel. We also have one on standby. We understand that this discussion is very heavy and could potentially be triggering or difficult for some. So at any point in the discussion, if you feel like you would like to speak with a mental health specialist, please do reach out to us via Facebook Messenger, and we will put you directly in touch. This will be a private and confidential discussion. We will also try as much as we can to find out what the existing resources for mental health are in South Sudan. So if you know of any, please do let me know, or please put them in the chat, or reach out to us directly. We hope that this could be the start of developing a database of resources to address this issue and to also provide specific recommendations on a way to move forward. So I will start by introducing our panelists. We have Dr. Kingi Mochache. Dr. Kingi is the Vice Secretary of the Kenya Psychiatric Association. She is passionate about child and adolescent mental health, and more so preventative strategies that involve instilling resilience. She has particular interest in substance use among the youth, and works currently at Nairobi Metropolitan Services as a medical specialist in psychiatry, and is also currently serving at Mama Lucy Kibaki Hospital. Dr. Mochache, like me, is an alumni of Precious Blood Secondary School, Riruta, where she is actively involved in mentorship and mental health programs. She gained a Bachelor of Medicine and Surgery from the University of Nairobi in 2007 and a Master's in Medicine specializing in psychiatry in 2016. She practices in both public and private facilities within Nairobi and Nakuru counties. We also have Mrs. Nancy Rahab. She is a counseling psychologist and an expert in mental health and loss and grief and trauma counseling. She has also agreed to be our on-site counselor. So in case anyone has any need to speak directly with a counselor during any point of this discussion, as I said before, please do reach out via Messenger and we will put you in touch with her. We also have Ms. Tokriel Maniel, who has a master's degree in social work and is currently working as a behavioral health specialist clinician at a psychiatric hospital. He has conducted psychosocial assessments on behalf of doctors and volunteers within communities to educate on mental health issues. He has been working in this field of mental health and substance abuse for the last 14 years. Ms. Dora Poni Loro has a bachelor's in social work and a master's in child welfare. She has also studied trauma-informed care and disclosure of violence and sexual abuse in children and adolescents. She has over 12 years of experience working with immigrant women and families, and is currently working as a child welfare curator with unaccompanied refugee minors. In her master's thesis, Dora researched on mental health among child welfare adolescents living at home. Mr. Kawach Thiu is a South Sudanese student at Cairo University, Faculty of Nursing in Egypt. He is also the deputy chairperson of a Wales Students Association at the universities and institutes in the Arab Republic of Egypt. Kawach's areas of interest are mental health, women and child health, public health, and students' welfare. We would like to especially thank Kawach for proposing this discussion, which he did due to concerns about the rising cases of suicide among the youth in Egypt. So today he will give us both his personal experience and what he feels are some of the factors that have led to this worrying trend among South Sudanese youth. I will start by introducing the topic broadly. Suicide is a global problem. More than 700,000 people die due to suicide every year, and it is also the fourth leading cause of death in 15 and 19-year-olds worldwide. Men are more likely to die by suicide than women. Although we say approximately 700,000 people die each year, we know that often suicides are not reported. For a death to be recorded as suicide, an examiner must be able to say that the deceased meant to die, which is very difficult. In South Sudan specifically, we don't have a death registry, so we don't ascertain cause of death, which means that this is a silent issue. We also know that for every suicide, there are many more people who attempt suicide or who have suicide ideation. A prior suicide attempt is the single most important risk factor for suicide in the general population. Disturbingly, over 77% of global suicides occur in lower and middle income countries. While the link between suicide and mental disorders is known, in particular depression and alcohol use disorders, many suicides also happen impulsively in moments of crisis, where there's a breakdown in an ability to deal with life stresses such as financial problems, relationship breakups, or chronic pain and illness. Many of us have experienced this, and many of us may have experienced suicide ideation as well. In addition, experiencing conflict, disaster, violence, including gender based violence, abuse, loss, and a sense of isolation are also strongly associated with suicidal behavior. Suicide rates are also high among vulnerable groups who experience discrimination, such as refugees and migrants and prisoners. Suicide also impacts those who have experienced a very disturbing event or trauma, or sometimes what we call post-traumatic stress disorder. So people who have experienced war, who have experienced violent crime, or natural disasters. All of this must be familiar to all of us as South Sudanese, both living in South Sudan and in the diaspora. We have experienced quite a number of what I have just mentioned. In South Sudan, suicide, for example, exceedingly affects the internally displaced persons living in the protection of civilian sites. And this is due to factors like confinement, having limited income generation possibilities, being idle, having experienced armed conflict, as well as gender-based violence. We cannot underestimate the effect of suicide, not just on the individual, but also on families, on communities, and it's a social problem. It also has long-lasting effects on the people who are left behind. So suicide is a serious public health problem. However, it can be managed with preventable, timely, evidence-based, and often low-cost interventions. Unfortunately, in South Sudan, we don't have as many resources as we should, given especially the experience of us in the past 30 years of conflict and post-conflict during the period of independence. For a national response to be effective, there needs to be a comprehensive multi-sectoral suicide prevention strategy. Working within primary healthcare in South Sudan, one thing I noted is that mental health is not a priority. The basic package of health services for South Sudan does not include a section on mental health. We tend to focus more on the direct and immediate causes of health and inequity, but not so much mental health, which, as you all know, we need to change. So the discussion today will focus not just on risk factors, causes, and consequences of suicide. We will also discuss the situation among South Sudanese, both in South Sudan and in the diaspora. Our panelists will share their experiences and enlighten us on red flags that we should watch out for, on preventive measures and coping strategies, and importantly, give us recommendations on prevention of suicide, management of suicide, as well as support services for the affected. As I mentioned before, we would also like to know what existing resources there are in South Sudan. So if you know of any, please do put them in the chat. If you are a counselor who deals with suicide prevention and management, do let us know. I would like to thank and welcome all our panelists for this session, for taking the time to share their knowledge and experiences with us. I would also like to thank the audience for joining us for this important discussion. Please do keep your comments in the chat respectful. As I said, this is a very difficult conversation to have, so please take that into consideration. We are currently streaming live from Facebook and YouTube, and do feel free to share this discussion on all your social media platforms. Do not hesitate to ask any questions on our wall. We will try to answer as many as we can, as we have this exceedingly qualified panel of experts. We would like to thank UN Women for their support. And I would also like to thank Aisha and Robert, who have been behind the scenes providing technical support. So welcome. Generally, the discussion will proceed by, first of all, having a definition of suicide and all these terms that we are using, motivation for having this discussion, the extent of the problem, the risk factors and what to watch out for, prevention and management, as well as recommendations and next steps. So I would like to start by putting Dr. Kingi on the spot. Dr. Kingi, if you could provide for us a definition of suicidal ideation, suicide, attempted suicide, and parasuicide, that would be very helpful for us.
Okay, thank you very much, Dr. Juliana. I'm trying to remember whether I saw you in Precious Blood, but let's focus on this now. Suicide is death caused by self-injurious behavior with an intent to die. So you injure yourself and you die. There's completed suicide where you actually die. Then there's attempted suicide where one does not die, but the plan was to die. And there's parasuicide, which there was no intention really to die, but you involved yourself in the self-injurious behavior. To note is 50% of parasuicide actually attempt again and end up really completing suicide. The other thing is something called deliberate self-harm, which is a concept most Africans don't really understand, which has no intention of dying. It's common in adolescents, children, and in women, younger women below 35, where one either cuts their arm or burns themselves just as a coping mechanism for pain. So those are the different definitions that we need to be clear about. This completed suicide, attempted suicide, parasuicide, and self-harm. Yeah, thank you. Dr. Juliana, you're muted. You're muted.
I'm sorry. Also, if you could define for us what is a mental health assessment and what is it, how is it done, and why is it done?
Okay, actually, the statement should be a mental state assessment. So a mental state assessment is, okay, for doctors, we usually use history and physical examination and investigations to come up with a diagnosis. For psychiatrists, for mental health practitioners, we focus more on the history and something called a clinical interview, a mental state examination. During this is how we may not focus so much on the physical examination and the investigations, though they are necessary to do. During the mental state examination, there's an ordered set of questions that we ask. We observe one's behavior. It's very structured, by the way. It's not just the way I can just talk to you socially. And it involves observing the behavior of the client. For us, we call them patient. The appearance, how they walk in, how kempt they are, the speech, how they're talking, whether it's loud, whether it's coherent. Then we ask them some questions to find out whether they are having what you call perceptual disturbances, thought content or thought form problems, their level of insight and cognition. Now, for suicide, it comes in at the level of thought content. So you may see the mood is low. So there's what I'll tell you that I'm feeling sad today, and there's how you appear. We call that affect. So I'll read the affect as maybe low or dysthymic. Then I'll ask about suicide, which is very important. Asking about suicide does not give the person ideas. It's not an embarrassing thing to ask. It is an important thing to ask during the interview. Depending on the answer, now we go deeper into that thought content, the seriousness, the plans, the duration, the intentions, and all that. So that's what a mental state examination is. It's our form of examining the patient after the history. And it helps us to make the clinical diagnosis of any kind of mental disorder, present or absent.
Thank you very much. So now that we sort of have an idea of what we are speaking about, I think it's always good to have a common understanding of these definitions. I'd like to request Mr. Kawach to really briefly give us the motivation for having initiated this discussion. What has been your general experience in the diaspora when it comes to this particular issue for suicide? And why do you think this is an important topic for us to be talking about and to address? Thank you.
Okay, thank you very much, Dr. Juliana. I'm really grateful to be here today. As you all know, we as South Sudanese, we have gone through a lot, and we are still going through a lot, and all this contribute to this topic we are talking today. Because as you all know, the risk factors of mental health issues come from the hardship we are going through now. Like we have been traumatized for so many years, and we are still being traumatized, and other factors such as economic and many other things. So my experience in diaspora, especially in Egypt here, has been good, but I have witnessed a lot of issues which are related. In Egypt here, since I came here in 2018 for the first time to be outside the country. I've witnessed almost 9 suicides. Yeah, they are not attempted suicide. These are the succeeded suicide. These are the things where people died. And the range start from, they are 25 to below 30 years, those who committed suicide. I'm not talking about attempted, where someone attempt to kill himself or herself, and other people who are suffering from mental health issues. This thing motivated me to suggest this topic, because back home in the country, this thing is very rampant. As you all know, like you have been in South Sudan, you have been working there. I think you have seen this.
I think we've lost him, but that is a very what a way to start. Obviously, this is a problem that we need to address, and we need to be talking about trying to find some solutions. And again, as I mentioned before, if you need to talk to somebody during the course of this discussion, do reach out to us. We understand that this is a very difficult topic. Dr. Riel, definitely, if you would like to step in, my question for you would be, what are some of the neurobiological factors or mental health disorders that may contribute or lead to suicide? And what are some of the triggers as well? And if you also have experience with this particular topic, definitely do let us know. Thank you. You're welcome. Dr. Riel, you're on mute.
Hello, everybody. My name is Togrel Maniel. Unfortunately, my camera is acting up, so you just hear my voice, but not my face. I've been in the field for 14 years. I'm a mental health consultant for 2 psychiatric hospitals in Texas, United States. Suicide has been one of the things that our community doesn't talk about, but it's a topic that we all need to talk about. It has touched each and every one of us. Whether you like it or not, it's something we have to address. It has hit home close to me. In 2017, my nephew, we always say committed suicide, but the trauma informed doesn't say committed anymore, because committed is like you committed a crime. So we don't use commit suicide. We say die by suicide. So my nephew died by suicide in 2017. He was 22 years old. Statistics shows males are the most that completed. Why? Because they use the most, I guess, the most crucial way to do it. He died by suicide, by completion of a gun. It was just one hit to his head, and that was it. So men are the most highly to die from it, but we don't even discuss that. I don't think suicide has been addressed in our community. And that's what got me into this field. It was because of that. we never talk about it. When your neighbor is talking to themselves, it was not schizophrenia. It was because they were bewitched by the next neighbor or somebody jealous in the family. But that was schizophrenia they had. So that triggered me. So with that said, suicide is one of the things we need to address. And it's not one time thing we have to address. It has to be a continuously, because in the diaspora, they're dying each and every day. We've lost so many of them by numbers. So whether we like it or not, it's a topic we have to address. And how do we do it? Is by talking about it. How do we help our country? How do we help our family? We don't like talking about it. My family, we haven't talked about my nephew since he did it in 2017.
Tokriel, my condolences. And it's definitely something difficult to go through. Could you also speak about, you started to mention schizophrenia. Could you also speak about some of the mental disorders, mental health disorders that might contribute to this as well? Because you've said something very important. We never talk about mental health in general. We talk about we are traumatized by the war, but we're never specifically talking about what does this lead to. So if you could speak about some of the mental health disorders that might contribute to suicide, this would be very helpful for us as well.
And that's where we come with dual diagnosis, meaning that the person has been diagnosed with a mental illness, depression, anxiety, bipolar, schizophrenia, and all those contribute to suicide attempt. Anybody that take their own life, they don't want to take their own life, but they feel that they've come to the end. They've been frustrated, nobody understands them, but there has to be a mental illness behind them. And that's where we come in with dual diagnosis, depression, bipolar, schizophrenia, and anxiety. They all play in the role of being, of that person being that sick, that need help.
And and as I mentioned before, post-traumatic stress disorder, which happens when people have gone through a very difficult traumatic experience, so violence, civil conflict that we have had several rounds of in South Sudan, having lived under constant period of war for a lot of us, children who have grown up in refugee camps. Those are some of the things that might lead to what we are observing, not just in South Sudan, but also those who are in the diaspora, because you carry the memories of what you have gone through. And unfortunately, for most of us, we do not seek counseling. We do not seek mental health
No,
support. For some reason, this is a little bit stigmatized. Or even within the diaspora, where there are resources, there is some sense of shame towards trying to get some help or some support. And this is quite unfortunate. Nancy, are you available? Maybe you can give us the East African perspective. What are some of the risk factors in East Africa? We know there are a lot of Kenyans who live, a lot of South Sudanese who live in East Africa. And also Kenya has a much more developed mental health sector compared to here.
Dr. Juliana, can I speak on, you mentioned the trauma.
Yes,
We are
yes.
South Sudanese, and
Yes.
we are traumatized. We have what is called intergenerational trauma.
Yes, yes.
So we were born into the war. My father was a commander in the army, SPLA army. We still have his trauma. I have my children, and it's so intergenerational. So we have children in the United States or diaspora, but it's international. It's intergenerational trauma, and that's what's going on. And our people don't seem. We have to educate them that although the trauma was with our fathers, here we are, and then our children, and they will continue with their children down the road because it's in intergenerational trauma, and that's what we have, and that's the issue we have. We have to understand that trauma first before everything else.
And I'm glad you mentioned that, because it is a compounding issue, right? And I think this is what you're really getting at. If our parents or grandparents have gone through traumatic conditions, this changes their behavior, how they react to us. People being very short-tempered, people being very violent. If we come to some of our communities that have lived through especially severe conflict, there's a lot of violence that is not spoken about, or that is taken as though it is the normal way of things. It is not the normal way of things. It is part of that compounding of trauma that we then transfer and transmit to others, to our children, to our neighbors, to the society in general. So I had started to ask Nancy. Nancy, would you be willing to give us the East African perspective and what some of the risk factors you're aware of in Kenya and in your work? Nancy works with LVCT Health in Kenya, so she's directly engaged with working with a very vulnerable and stigmatized population as well. Welcome.
Thank you, Dr. Juliana. I hope you can all hear me. Okay,
Yes.
from my perspective, people are starting to seek medical attention as far as mental health is concerned. Otherwise, stigma was ruling the day because, as you said, everyone thought when you mention mental health, it's crazy people, it's people who've lost it, and so on and so forth. So stigma was clearly visible as far as mental health was concerned. But now with activism and people championing mental health for everybody, we are starting to see it pick up and people coming and wanting help in terms of counseling, in terms of therapy, or even going to see a psychiatrist and not feeling like they're stigmatized. However, we're also looking at political crisis in East Africa. We're looking at informal settlement are exposed to so much trauma, and now
We've lost you, Nancy. Maybe you can turn off the video.
let me try.
Yes. Now we can hear you well.
Okay, fine. So I was saying we're seeing some NGOs come in and try and fund mental health activities in the informal settlement where there's a lot of trauma, a lot of gender-based violence, a lot of domestic violence, triggering trauma and PTSD in people or among family members. So in East Africa, I would say the mental health situation is changing in terms of people responding or taking up services that are provided as far as mental health is concerned. We're also seeing people also and doctors also reach out, and also for us, the mental health workers trying to create links and referral system where I can maybe link a patient to a client of mine who would be now like Dr. His patient, and we are able to work together.
Thank you, Nancy. And I can speak definitely to the growth of psychiatric services in Kenya. I have a friend who is currently working as a pharmacist in Mathare Hospital. And I know that 20 years ago when I was younger, we had a very different perception of what we would call madness, right? It was not diagnosed as either bipolar or schizophrenia or anything. But now we do have a much more well-developed mental health sector in which I have several friends who have been able to go and get support, not just counseling support but also treatment where needed. So thank you so much for this perspective as well. Miss Pony, let me bring you in so that you can speak to us from the social worker perspective. Let us know about this issue, suicide among immigrant and refugee communities. What are some of the causes of this? And if you're aware of what some specific rates are among South Sudanese immigrants.
Yes, thank you so much. I would briefly, before I go to your question, just mention the social workers' role in regards to mental health, because I think it's important to mention that.
Yes, apologies for that.
Social workers, and mainly clinical social workers, their focus would be in regards to mental health, the prevention, treatment, and rehabilitation. Because the prevention then aims to reduce the incidence of disease or dysfunction in a population through modifying stressful environments and strengthening the ability of the individual to cope with the stresses of everyday life that has been mentioned. And prevention here involves the promotion and the maintenance of good health through education, like getting people aware of the stresses of everyday life, and then getting attention to the basic needs that need to be covered for us to be able to kind of reduce the stresses of everyday life. And in mental health setting, then preventative activities would include the public and client education regarding emotional self-care is really important. And as in an African setting and even the South Sudanese, we don't really take care of our emotions. And that also triggers on building up mental health problems. And so as a social worker, it's important that we work on building healthy relationship, building community knowledge about the skills on how to tackle these everyday challenges, and then the social action to that. And then it comes to treatment. When we see that someone is going through experiencing some mental health problems or issues, what do we do about it? The aim here is to reduce the prevalence or the number of existing cases of mental health problems. But then the issue here is for us to have a name, to name it, because in most African countries, we don't have a name to depression, we don't have a name to mental health problem. So it becomes a problem talking about it and early being able to diagnose it and even intervene and treat these mental health issues. And then the other thing is to have also rehabilitation. How do we work to reduce the after effects and disorders of mental health problems? So as a social worker, these three issues are really important for us to look at. In regards to being in the immigrant communities or how it is here, we know, as mentioned, that immigration causes a lot of trauma. You know, the traumas of war that makes us to move from our countries and resettling in other countries with also stresses that make lives difficult. We see that many refugees have high prevalence of common mental health disorders, particularly the post-traumatic stress disorder, as you mentioned, which in turn leads to suicidal behavior. And then refugees in the process of migration are accompanied with these traumas from war and the journey that they've taken through before they reach, for instance, to Norway. That's a long journey. I work with young unaccompanied refugee minors. They've taken a long trip to reach to this destination, and they've really experienced a lot of things that makes life difficult, the new destination. So as immigrants, we see that especially in the young population, we see South Sudanese population in the United States, in Canada, and Australia, where the suicide rates have also increased. And it's mostly because as parents, you know, traumatized parents who haven't dealt with their own issues, they're not able to be there to meet the needs of the children and the emotional needs of the children. So we see that many young people have also going through a lot of mental health problems. And a group of young people from Australia have spoken about that they're tired of losing their friends by suicide. And because they feel that the parents, they are not like able to talk about mental health issues with the parents, because they kind of compare what the parents have gone through and the things that they go through. And they see that what the parents have experienced is even more than what they've experienced. And they feel that the parents are not in that place to be able to talk about mental health problems. Even suicide, asking about it, talking about it is a taboo already in our communities. So it's difficult for us to kind of put words into it. And for our young people, it's even harder then to be able to open up about it if they're feeling, if they have suicide ideation. So I think it's a very good thing that we're talking about it. But as grown-ups, as parents, we really need to be open about it in our communities. We first have to have the language to be able to speak about it, and then break that stigma and be able to discover the ones that are really having it tough.
One thing I always say is that we all need mental health therapy. We should have therapists for everyone. You've brought in a very, very important point, which is that the process of migration and the process of trying to live in a community that is completely different from where you have come from is also an additional stressor, an additional life stressor. I often wonder if there are outcome differences among refugees depending on where they end up in. Norway has a much better social support network, for example, than the United States. In the United States, a lot of refugees were resettled in the Midwest, which is a very different demographic population, but also the kinds of communities they were placed in are also communities experiencing specific challenges, right? So we have diaspora communities who have been traumatized, moving to completely different societies and living in very challenging environments. And we have children who go to these schools and they experience discrimination because they look very different from everyone else. They might not speak the language. This is both for adults and children who might not speak the language, who have a very different cultural practices. So the process of migration and the experience of being an immigrant in the diaspora is also an additional cause of risk factor for suicide. For South Sudanese within South Sudan, I often wonder, we have been refugees over and over again. We were refugees. We came back to South Sudan. A few years later, we were refugees again. We are refugees. We are internally displaced within South Sudan as well. So we do have, again, compounding risk factors that are continuing. There has been really no break. So in a way, we do need to normalize the idea that anybody should be able to go for mental health support. Not just young people, but also adults who experience this, whether it is in their past or during their childhood or in their present, based on how some of the challenges and life stresses they're having in their day-to-day life. I think this would be a good time to really speak about myths and misconceptions of suicide. Dr. Kingi, maybe you can start us off by speaking about some of the common misconceptions about suicide for a start. And also, I feel like we might have discussed this, but what are some of the risk factors you find for suicide that are common that you have experienced? Thank you.
Okay, thank you for that. I don't know which myths I can talk about, but maybe misconceptions. In my practice, I've noticed that most people do not take it seriously. First of all, I'm at a disadvantage because I'm a psychiatrist. I get to meet the attempted, the attempted. A pathologist will know the
No, but that is
completed
good.
suicide.
No, but that is good
Yes.
because you're sort of at the prevention stage, right?
Yes, I have.
Yes.
So I come across mainly the attempted, and maybe probably the parasuicide, though we try our best not to make that diagnosis because it's very difficult, even for me as a mental health specialist, to know whether the intention was really to die or not. So the biggest misconceptions or about this whole thing are that they weren't serious, there's nothing wrong with them, there's no mental health issue, there's nothing like depression. She's trying to run away from reality, she's being selfish, she or he is being selfish, they're not thinking about other people, they're not imagining what they'll do to their relatives. It's usually on that line. That's what I would say. And as far as the risk factors, I'm also at a disadvantage whereby the bulk of my practice has been with children and adolescents. I was working at Gertrude's Children's Hospital. And fortunately, I've actually met a number of South Sudanese. I can see the common risk factors in our setup in Kenya, both Kenyans and other immigrants, like people who are not Kenyans. The biggest risk factors are usually in the relationship angle. So most of the time, it's to do with not being understood by your parents or being in a kind of a setup whereby you cannot express yourself. Maybe you're having academic challenges. It's usually on that line. It's preventable in that if our social connectedness was better, I think the cases would be so much less. Of course, there's the obvious factors like being male. In fact, male, not in a bad way, but men rarely will I see an attempted male. So I'll only see maybe the one who's telling me during a mental state examination, a clinical interview, of their intention. They also tend to use the more lethal methods. So hanging, Kenyan statistics, actually pathology report, show more men than women, which you had also mentioned. And I found, by the way, some statistics about comparing Kenya and South Sudan.
Please let us know. Yes, definitely.
No, I don't know. It was WHO, so probably it's, and I don't know. But it showed we are worse off. We are at Kenya is at 6.1 per 100,000 completed suicides, and South Sudan is at around 3.8. I have a feeling it has to do with some not very good reporting, because even for us in Kenya, definitely we are underreporting, seriously underreporting.
Yes, just to speak on that, yeah. It's definitely underreporting because we don't have a death registry, so there's no way to even do cause of death assessment. So you have to have sort of those two things in order to have actual statistics on deaths, right, and causes of death. We don't have a birth or death registry, so
and then families don't want to talk about it. So
exactly. Yeah,
we don't address that as an issue.
Yeah, sorry, I interrupted, but go ahead, Dr.
No problem. No problem. So the risk factors are male. Risk factors are the social connectedness issues. Then there's also the biological aspect, which is very difficult for most people to understand. That's where African culture, the whole thing about witchcraft comes in. It's because there's a genetic predisposition to different mental illnesses. So you'll find like an aunt, an uncle, a cousin, all have depression. Somebody died by suicide, and they say it's in that family. Someone bewitched them or something like that. And it's just the biological or genetic predisposition which has not been addressed. I think those are my major. The rest are what you had mentioned at the beginning in terms of risk factors. That's what I would like to bring to add to the discussion.
Thank you very much. And I would like to mention that, we're talking a lot about men, suicide being more prevalent among men than women. We also know men are less likely to speak about their issues emotionally, to open up and talk. And this is one of the way that we really stress, right? So this probably is one reason what puts them at a higher risk. They also have, in our cultures, they're the ones responsible for maintaining the household, right? So this could also be an additional risk factor. One myth I would say is that is to talk about suicide is not it doesn't make someone a bad person. It is something that happens, and we should normalize it. So the myth that it happens to those people and would not happen in our family is not something that we should promote. We should be aware that it is something normal. It is something that we can address and deal with. And as Ms. Pony mentioned, without naming a problem, we cannot address the problem. Dr. maybe you can also talk to us about some of the myths and misconceptions that you're aware of when it comes to suicide, as well as what are some of the risk factors. I know this is something very personal to you, so you will be able to give us that perspective as well. And once you finish, I will call on Ms. Pony. Thank you.
Thank you. As I said, one of the reasons why I got into the field was because mental health. I got intrigued because when I was growing up, it was the neighbor bewitching the other person, but I didn't know it was a disease. Mental illness is a disease like cancer or any medical issues, but our community doesn't accept that. So for us to even actually to start addressing the issue, we have to accept it that it's a mental issue, it's a disease. These people didn't choose to be diagnosed with bipolar or schizophrenia or depression. It's unfortunate. So that myth has to go. We have to treat it as a medical issue. Mental illness is a medical issue as any medical issues, cancer, high blood pressure, and that. So until we accept that and address that, and then we can move on. And then, the risk factors are untreated mental illness. And I had mentioned that the bipolar, the depression, the schizophrenia comes in. Prior to history, the person may have attempted that in the family, or the family may have had a mental issue or have attempted, but they don't see that as an issue. It's just, South Sudanese or in Sudan, South Sudan, we don't even diagnose that as an issue. We don't. Until we acknowledge that and accept that it's an issue, we cannot move forward. We have to all accept that as South Sudanese, mental illness is an issue and it's staying and it's killing all our generation in the diaspora. I can't speak for South Sudan. Haven't been there. I was there for my sister's wedding in 2015, my sister's wedding. But other than that, it's been 21 years plus after that when I left South Sudan. So, but until we accept that it's not just a myth, but it's our youth are dying in the diaspora. How do we do that? Until we acknowledge that and accept that it's an issue, we cannot go ahead. So we have to do that. That's the first step: education, acceptance.
Thank you very much. And I definitely agree. We have to take mental health as something that happens to everyone. For some, it's worse than others, but it's certainly, we all go through periods of stress, periods of sadness and anxiety. Some might need more support, either therapy or sometimes clinical treatment. But it is something that is normal, and we should normalize it. It is not bewitching. It is not, you know, any other kinds of ways that which we try to dismiss the issue. It is definitely something that someone should seek help for, and having a mental diagnosis it should not be a taboo. It should not
Yeah,
be
or
a
a
stigma
stigma.
or a stick. Yes,
It's,
yes, yes,
it's like
yes,
cancer or high blood
yes,
pressure.
yes, exactly. Miss Pony, maybe you can also talk about some of the myths and misconceptions we have about suicide. And when you finish, I would like to bring in Nancy to also speak from the Kenyan perspective as well. Thank you.
Yeah, I'd just like to mention a few myths that are also kind of making it difficult to talk about suicide. And the other myth here is like, if you ask someone about suicide, that you may plant the idea of suicide in their minds. Because, you know, many people give us like signs that they really want to, or maybe take their lives. And so it's important for us to dare to ask the questions. Are you thinking of that? Because actually for many people it would be a relief that someone has really understood me, someone knows that I'm going through a tough time and has understood that I want to kind of take off my life. I want to just make things easier for me, because then it becomes a doorway to getting into a conversation about the issue. So it's a myth that if you ask someone about suicide, you're planting the suicide idea in their mouth. So it's better to ask than not to do it. And the other one is that suicidal people are fully intentional about dying. Not all of them, some are intentional about it, but for many people, it's a mental health issue. There are a lot of underlying issues that they need to talk about it, and they need help to deal with it. So it's very important that we also take out this myth. The other one is that everyone who dies by suicide is depressed. Not everyone is depressed. There are a lot of underlying issues, as have been mentioned already. So it's important that we don't cover up and say that, you know, someone who is suicidal is depressed. And then it could be also some certain like improvement in the emotional state of a person after an attempt of suicide. But that does not mean that the person is already, you know, healed. So it takes time. So it's very important that we also give time to the person and give the support that the person needs around them. So these are just the few myths that I want to mention. And then we can talk about the stigma after.
Yes, I really like that you brought up the issue that talking about, you and actually Dr. Kingi talked about, you know, talking about suicide does not lead to suicide, you know, ideation, or leads to someone to wants to commit suicide, as well as the fact that sometimes people who attempt suicide have the full intention. Sometimes it is because they do not know what else to do. I can speak personally that I have had suicide ideation, not because I'm depressed, but because you know, we often question what is the purpose and meaning of life. And so, you know, it's something that, you know, as I said before, we should talk about. I have a friend that planned her last day. She wrote about it, posted it on the web, and she was successful. And I often think about, maybe if we had talked about this issue more openly, she would have been able to get the resources and the help that she needed at the time. So thank you for those 2 points, those 3 points as well, for bringing that up. Thank you so much. Nancy, I'd like to include you in this conversation from the Kenyan perspective, and as a psychologist, what are some of the myths and misconceptions you have come across, and what are some of the risk factors that you are aware of as well? Thank you.
Okay, thank you, Dr. Juliana. One of the myths that even circulate, you can even see it on social media when someone posts like they want to take their life, is that this person is attention seeking. I find that very unfortunate when people actually say that. Yes, and the other common myth is that the seeking treatment is a sign of weakness. And that makes people even not want to come out for therapy or even going to a psychiatrist and getting the medication. The other myth I've heard several times is, especially when it concerns the youth and the adolescents, that they are spoiled brats. So when you see like someone has been cutting, there's so much accusation that they are spoiled. They just want to get something. And this is even in the workplace when there's so much pressure and targets to meet and someone attempts suicide. As people kind of tend to feel like they want the assignment given to someone else, that they don't want to complete the task they've been allocated, which is very, very unfortunate. And know that I think people are yet here in Kenya to understand mental health, even at the workplace, and things as simple as burnout are not taken seriously. So you find that people struggle with a lot. You have family related issues, and then you come to work, there's a lot of pressure, you have targets to meet, you have friends, you're trying to fit in, it's really a problem. And then now you feel like there's no meaning to all that, and that's it. And then we also have people even as young as in high school not able to fit in at all. The pressure is so much, especially in big schools. You've talked of being in precious blood. I'm sure you can relate. The pressure was real. So
Yes.
for a child, for a young student trying to give the grades the parents are expecting or the school is expecting, and also trying not to be last all the time, or even struggling with that last number all the time, and everybody even seeing like it's funny that they are not able to even improve, it can be very, very hard. So we even seen students in high school attempting suicide. And teachers now, the only thing teachers do is they suspend this student. That is not really helping. And then they force them to go for therapy as a punishment. So you can see now from that angle, it's really complicating issues even for us, because this student comes as a very resistant client. And come to think of the assessment, you find that they are very, very depressed because of even the situation at home. Families are separating, and this student is expected to give clean A's in school, and is not even able to process a loss. We're in the COVID era where there is sudden death everywhere. So things are tough. So I think the risk factors are so many these days that we yet to find ourselves in a place where we can say we've done enough. And we also need like the government to kind of help people understand that mental health is serious. It's just like the way you'd say you have diabetes and you go and seek treatment, take day off and attend to that, or even get to a situation where your employer will actually even pay for it in case it happens. Yes, thank you.
Thank you so much for speaking about that, and especially for bringing in the fact that we are living through a pandemic that has been, for a lot of people, very socially isolating. We don't know what the extent or the effect of isolation or social distancing measures, including restricting movement, has been on families. We know the current research at the moment says that there have been increases in violence within the home, domestic violence, including gender-based violence within the home, as a result of COVID. There's also a lot of stress in terms of people have lost their livelihoods, and so this is also an issue, an ongoing issue. And so, emerging research is suggesting that there has been an increase in suicide just because of us having lived through the past 1 year, and I'm sure this is happening globally. So, and you mentioned precious blood, because you know how difficult and how stressful it was for a lot of us. When children, young people are at a certain stage of life, adolescents, your body's undergoing a lot of changes. You're experiencing a lot of trying to understand the world as an adult. And so the education, being in an environment where you're expected to succeed, and constantly succeed, is also an additional stressor. Kawach, if you could speak on the perspective in the diaspora in Egypt, especially among students and young people. You mentioned that you know of 9 people who successfully committed suicide. What are some of the misconceptions that that might have resulted in them not having gotten any help or gotten any support? What are the risk factors in your opinion? So if you could speak on that, and then I would like Dr. Kingi to jump in and speak. And after this, we are really going to start talking about prevention and management. I think this is really, really important and critical at this point in the discussion. Thank you. Kawach, go ahead. Kawach, you're muted.
Okay, thank you so much. Yeah, I can assume because actually I don't know the clear reason why there is this issue of suicide and so on, but I can see from the experience I have here, I can just assume or come up with some of the reason I think are the problem. Here in Egypt, in this society we are in, especially here in this country, I mean, there are so many challenges we face here in this country. Apart from the challenges we came within our country, the problem we came with in our country are already there, but also the society here, and the things are not that easy. And I will mention, and I have to be specific.
Yes.
The problem I think that contribute to this alarming society in Egypt, especially among students, is the issues of financial issues, and financial support is not there completely. So many students are struggling with life. It's very difficult to be in this, be a student, and also you're struggling with life. It's very difficult to be able to work. And here in Egypt, people work for 9 hours, 10 hours, and 12 hours. So imagine someone going to work, sleep at work, and then tomorrow morning, he or she miss the lectures. What will, there will be a lot of thinking. There will be a lot of thought in his head, and that may contribute. Another thing is a lack of counseling. In Egypt here, as foreigners, like we as a foreign student, there is no any support at all when it comes to social support, hospital, anything like that. If you are suffering, you are just suffering. You don't have money, that's all. And there is no one to talk to because everyone here is struggling. Even if someone is feeling like there is something wrong with, nobody to talk to because we don't have parents here. Everyone here is on his or her own. So this one is very difficult because when it comes to this topic, some people have to express what they are thinking or their thoughts. But if you don't have anyone to talk to, how will you feel? It may lead to suicide. And these are the things, and just few of the thing I thought like they are the cause of this issue. And also the society we are in, like there is a lot of abuse. I'm sorry, like I don't want to tarnish the name of the country, but on the street there are a lot of names, and harassment and so many other things like racism and so on. Imagine if I'm suffering with I have an issue in my within myself, and also I get outside and I get abused. This and all will contribute to suicide issues, and so thank you. Yeah.
Thank you so much. And I will mention it, which is discrimination.
Of course,
And
yeah.
it doesn't just happen in Africa, in Egypt. We talk a lot about it. South Sudanese in Egypt, whether they're living in the refugee camps or in the urban areas, experience a lot of discrimination. We know the names that they call us. This is not just in
Yeah.
Egypt. I know the situation in the United States as well. There is a lot of systemic racism, but also just within daily interactions, you experience discrimination, and racism and stigmatizing, and so this is a problem that we should also be open about. That students in Egypt, students in other countries, students, I'm sure it's an issue in not just the United States, but
Yes.
also everywhere
Yeah.
everywhere we are, that we do experience discrimination. We do look typically different in a lot of places, and this leads us, unfortunately, to having people say certain things about us, and that is an issue. Thank you so much for bringing up that point, and thank you for really telling us about what some of the challenges are for students in Egypt, and the lack of support, and also bringing up the fact that many of our young people are growing up without parents. Whenever I read about, for example, we talk a lot about the lost boys and girls, a lot of whom came to the United States or Canada or Australia on their own, having experienced all that trauma. We never also, we get to hear about the ones who are successful. We never get to hear about the majority. and what has happened to them, and what they have experienced, and how this might contribute to this particular issue we're talking about. So I think it was very, very important to understand what the youth perspective is. So thank you, Kawach.
Thank
Dr.
you.
Kingi, I'd like to bring you in. You had some points in our internal chat that I would like you to speak about, and also start us off on our thinking with regards to prevention and also management of suicide, how it is done in Kenya, and to maybe start us thinking about what we should be advocating for in South Sudan.
Okay. The risk, what I wrote on the chat was other risk factors which I had not mentioned.
Exactly, yes.
That include, so I'll only mention the ones that have not been said by anybody. The first one is a sense of social isolation. So, this is actually a mental concept. You can be alone and not feel lonely. You can be in a crowd and feel lonely. So, that sense of social isolation is actually a very big risk factor, whether you're at home or you're elsewhere in a place where there's nobody else like you. Secondly, it's the contagion, what we call suicide contagion. Like, I think we're all aware, in Kenya, we lost a doctor, and it was really all over on media. When you know the person individually, it is said that sometimes that puts you already at a higher risk of thinking about suicide and actually completing it, because there's what we call just suicide contagion. That's why whenever a loved one, like a family member, somebody who's close to you, someone who really means something to you, you have an emotional kind of connection, it is important to debrief and think about the situation, because many times it leads to complicated grief, to guilt, to many other factors. Another risk factor of suicide is a barrier to healthcare. I think that has been mentioned indirectly by different people. You can actually have good hospitals, but you do not have a place where you can go talk about mental health issues. They can treat malaria, they can treat everything else, but they do not know how to handle the moment I say, I feel like I want to die. So now connecting that to the management principles, actually for us, they're just very straightforward. The first one is, of course, when one attempts suicide, those are the ones we'll meet. There's the medical care, which I guess we shouldn't talk about here. So either the surgeon will take care of whatever the person has done, or the toxicologist. Then there's the assessment, of which it's not an emergency at that time. You do not rush to start talking to the patient immediately. After you, first of all, stabilize them medically, and then after that, we have now the mental state assessment, find out, as Dora said, sometimes it's not a mental illness. It might be other issues. It might be impulsive. It might be financial issues. By the financial is a very, very, very big factor, whether it's a student, and especially these men, we're talking about male. It's usually either finances or relationship issues. So we first do the medical stabilization, then we do an assessment, and then if there's a mental illness, we handle it. So as a group, I would suggest, if we're to look for preventative methods, there's the CDC strategic planner that starts with data. I think for South Sudan, we need correct data. We need to know how many, what did they do, what method did they use, what were the causes, what were the likely, what was the thinking behind that individual. Then after the data, or even as concurrently we collect data, because that might be a bit difficult, there's the science, so you can learn from Kenya. I'd like to say in Kenya, I know we appear like we're doing well, but we're not really. I think the game changer for mental health in Kenya was actually our president. In around 2017 or 2018, he talked about suicide, he talked about mental health in one of the Madaraka Day celebrations. And at that same moment, I think just him speaking about it in public changed the stigma situation immediately. From that, he set up a mental health task force, which is made up of psychiatrists, psychologists, different people in the mental health care spectrum. And we started integrating mental health services, not only in Madare, but the Madare still has stigma. We have mental health services in most private hospitals, in other ordinary hospitals. That way, someone feels like they can actually walk into this hospital and get help. So that's a strategy I think that would really help. It really worked if you get the people in power to speak about it. And on top of that, if you get to integrate it into normal healthcare services, because as Tokriel, sorry if I pronounce your name wrong, said, mental illness, mental disorders are just like other, it's like diabetes, hypertension. So why do you have a separate hospital for treating this, or a separate, just make it part of the system. Those are the actions I would say, and then collaborate with Kenyans, with anybody who can help, with teachers, integrate it into HR policies. That's what I would say.
So I think we need to start lobbying Aisha and UN Women and South Sudan Women's Intellectual Forum to lobby the president to talk about mental health, because this is an issue in South Sudan that we are ignoring. As I said before, even our basic package of healthcare services does not integrate mental health within it. If you look at any of the donor-funded health system strengthening mechanisms, mental health does not appear anywhere. And I know this because I worked in the USAID funded ones, the major USAID funded ones. And so
it has to be one of them. It has to be the top, especially in the diaspora. We're losing our young generations.
And
I'm talking about money, but everybody, we're losing each and every, the numbers. I don't think you have the numbers, but it's ridiculous how many kids we losing from the age of 18 to 25.
Yes.
Either in America or in Australia or in Canada, they're taking their own life. And it's something we have to do. The reason our parents brought us to United States was to get a better life, but we're losing the kids. These kids that we brought, deliver them in the United States, but they're dying. Because why? They could have been between two cultures, the South Sudanese culture and the Western world culture, American culture or Australian or Canada, because they don't know, they don't understand it. So how do we do that? It's one of the things the government of South Sudan has to address it. And regardless what, it's my passionate, we have to address it. As I said, it's closed. Once I lost my nephew to suicide, it's become a mission in my life. I have saved so many lives, I couldn't save my own. That's the guilt I have to live with. What do we do as South Sudanese?
So I think we definitely need to start advocating and lobbying for this to become a priority intervention. I think about Rwanda after the genocide. One of the things that they prioritized was community health, psychosocial support. So a lot of examples that are given within the field of public health in terms of societies that have undergone large-scale trauma is the approach that was taken in Rwanda, which is they try to socialize counseling and psychosocial support within the Rwandese context. And this happened after, their understanding that some of the models that are used in the developed world might not necessarily fit within the constraints of Rwanda. So we do have examples from Kenya about how they are addressing mental health, as well as the challenges they're still experiencing, as well as normalizing the issue of mental health and talking about it openly, including starting from the top. And we also have examples from or models from countries like Rwanda that have undergone a large-scale traumatic experience. Nancy, I think we might have lost Nancy, but when she comes back online, I would like for her to speak about mental health and the disciplinary forces. And thank you, Nancy, for bringing this up, because we have totally not talked about it, even though we know that we have a very large standing army in South Sudan. We also have quite a number of militias in South Sudan. And so definitely we would like to understand mental health within this particular sphere. Tokriel, I would like you to speak again. You are raising a really important point, which is mental health in the time of COVID. So if you would like to speak about that, as well as specifically, what are the steps parents and society members can take to really prevent suicide to be more receptive to discussing mental health as well. Thank you.
Thank you, Dr. Juliana. I think the first step we have to take is to accept mental illness is here to stay. It's, as I mentioned earlier, it's like cancer and other disease, but we have to accept that it exists. And with that, how do parents or community or family members take that into existence, that it is here to stay and it's not going to anywhere? And unfortunately, we're losing our young generation to this. Parents came to United States or Canada or Australia to give life to this generation. But what are we doing? We're burying them. So we go to, because they committed suicide, we don't talk about them, we bury them. We go to our families, at the end of the day, we bury them. And then what? We move on. What have we done to this generation? We're killing them and we're burying them, unfortunately, until we address mental health as an issue in South Sudan, in the diaspora as an issue. That's the first step we have to do, education. And the question you asked, the prevention, suicide prevention. None of these kids or none of these people want to die. But why do they take their own life? Because they come to the end of their rope. They take their own life because they feel there was no light at the tunnel. It came to an end. Until we acknowledge that, that's the first step, education. Mental illness, suicide attempts to suicide completion are here to stay. How do we do that? Educate each and everybody, South Sudanese, whether in South Sudan, whether in America, whether in Canada, Australia, or Canada. We have to address that and accept that that's an issue, and it's an increasing issue. Unfortunately, we're losing and burying these children. So how do we prevent that? You mentioned suicide prevention. None of these children or father, whoever completed suicide. Back then, we used to say, attempted suicide or completion. But then, trauma said that they did not, committed suicide. They did not commit suicide. They they completed. Because then, when we say committed become a crime. They didn't commit a crime. They just took their life. So the trauma-informed term is the suicide by completion. So they did not complete a crime. They committed a crime, they took their own life. So it was not a crime they committed. So we have to address that. They did not commit a crime. They took their own life because they came to the end of their rope. Why? In the Western world, parents are working 24/7. They have no attention to their children. Don't talk to them. And I keep telling them there is intergenerational trauma. Our parents went through the trauma. We went through trauma. As I said, my father was in a command in the army, Martin Manyela Ayuel. I was born into the trauma. I grew up in the trauma. I came to the Western world. I have 4 beautiful children, but those children still have my trauma from my father and my mother. And then we continue. And then down the road, they'll have their own children and they continue. So it's intergenerational trauma. How do we address that as South Sudanese people? That's the one thing we have to address at first. Because it is there it's going to stay there until we address that. How do we address that? Our grandfather went through the trauma, but how do we address? These kids are born in Canada, America, Australia, but they still have our trauma because we were born into the trauma. It's the intergenerational trauma. Until we address that, then we move on. How do we help this new generation not to commit suicide? But they have to understand your parents went through the trauma. It wasn't by their choice. It was because their mother's choice. Unfortunately, the father didn't choose that. They didn't decide to go, we were going to go to war or whatever they want to. So we have to address the intergenerational trauma, and then we move on to the next trauma, and then the next trauma. So it's going to be, we have to address the whole trauma all the way. But then we have to save these children, or else we're going to bury each and every one of them before we go back to South Sudan. Why? Mm-hmm.
And I want to say that, especially for people in the diaspora who, resources are available, it's not like in South Sudan where there is that, or in Egypt where there is that you don't have actual access to resources. So we should probably prioritize communicating with our friends, our families, society members.
Dr.
Whenever we
Juliana,
are in. Yes.
unfortunately, we have the resources available, but like I work, as I said, I worked as a mental health behavioral specialist. But when my fellow South Sudanese come and see me, they shut off, and I have to back off from the doctors, and the doctors are like, "Why are you not seeing them?" I'm like, community conflict. I know them from the community. Instead of them being happy that I'm there to protect them and give them the best service, they're ashamed to see me there, and it's unfortunate. So the Western world, the diaspora, is not going to go until we acknowledge that when you see me, I'm not here to shame you, but I'm here to help you as a brother, as a sister, as a mother, as anything. If anything, I want the best care for you. Until we acknowledge that, that's the first step. We have to do that acknowledgement and then education, and then we move on. But it's the stigma we have, because nobody wants their children or the family members to be known as crazy, as nobody wants that. Until we accept that mental illness is not craziness. It's a medical issue like cancer. So until we accept that, then we have to move on. So when they come in and they see me, as soon as they see me, they freeze and they don't want to see me anymore. And it's unfortunate. I have to see them. I have to see them before the medical doctor sees them, because I'm the behavioral specialist. And I have to excuse myself at some of the cases. I'm like, doctor, I'm unfortunately the medical doctor. I can't see this patient because of conflict of interest. But it's because I know the family and because the way they are so resistant. But I was hoping that they were going to be happy. Their own family member. I hope that that's how they see me. But they see me as the enemy of the system. So.
And I think this is part of, we talk about education, and as social workers, as public health persons, as activists, as people engaged with our communities, one of the things that we need to learn is how to communicate, how to educate others. And so this is what I'm saying, that we know that the reality of the situation today. We don't talk about it, it's stigmatized, etc. We need to start thinking about ways of really speaking with our family members and our friends to try to normalize discussing about mental health, number one, and also to normalize going to see a mental health therapist. Because even among non-South Sudanese people, it is still somehow stigmatized. It is still somehow looked at as though it means you have a problem or there's something wrong with you, as opposed to you're trying to really address an issue that you have identified or trying to get just support in general. So our role as people who are aware, and our role as the audience too, that has been part of this discussion, where we've talked about, what it is. We've talked about myths and misconceptions. We've talked about the extent of the problem, not just in South Sudan, but in the diaspora. Can we start to think about ways in which we can communicate to others and normalize this situation? I'd like for Pony to speak about some of the warning signs for suicide. But before that, Dr. Kingi has to step away in a few minutes. So Dr. Kingi, if you could maybe give us your recommendations and make some final remarks, and then after which Pony will talk to us about some of the risk factors that we should all be aware of or to look out for. Thank you.
First of all, I'd like to say thank you for getting me into this panel.
No, thank you so much.
I've actually learned a lot. I've learned about the generational trauma. There are things I think we may not think about until you expose yourself and meet other people. My recommendation, or what I'd just like to say, is that there's hope and there's help and healing is possible. There's hope, there's help, and the healing is always possible. As long as there's life, there's hope. As long as there's life, there's hope, and healing can occur. What if we're to take action points right now? I would say, I don't know how powerful the forum is, but as an individual, I think we should all talk about seeking mental health care to anybody, whoever you meet. Try your best to influence, nowadays there's social media, there's Twitter. Try and influence the policymakers to make it a priority and to be real about it. Actually, the biggest problem is usually denial, even within the leaders, denial of the problem as it affects them as an individual and as a country. Finally, I'd say invest in social connectedness. Just invest in getting to know yourself and to know the person who's next to you. And if you're maybe in a country where there's a lot of discrimination, find people who you can get along with. You don't have to get along with everybody, but just invest. There's something called social capital, which people don't think about. Friendships are so important. It's not just all about academics and money, and making it actually involves taking care of yourself and socially connecting. So I think that would go a long way to help. Sitting from where I am and listening to all the different challenges with different in different ways. And as a mental health specialist, I would say just focus maybe on those three to begin with, and then we can do the other policies and data collection as time goes on. Yes.
Thank you very much, Dr. King. We have learned a lot from you as well. And I really appreciate you taking your time to be with us to talk about mental health in South Sudan, which is not where you're working. We will, as the forum has numerous lawmakers, has received a lot of attention recently. So I am optimistic that there may be ways in which we can influence and advocate for and lobby for, mental health and suicide prevention to become something that we focus on, especially within the Ministry of Health, that it shouldn't just be primary health care, but also mental health is part of health, right? It is not something different. We tend to think of it as a separate issue. So I think this is, one of the things that, I would like for us to think about as recommendations and next steps from this this forum discussion. So thank you very much for your time. Anytime you need to go, you're definitely free to go. We appreciate your input and we have learned a lot from you. Pony, I'd like you to maybe speak about what parents, what we as individuals or as society members should look out for in order to identify what are the warning signs essentially. And then I see that Nancy's back with us. If she could talk about mental health in the disciplinary forces after that, that would be very useful for us. Thank you.
Yeah, thank you so much. I just want to add on what Tokiel has said. I really so much agree with you. I think as parents, I'm a parent of two, and I work with young people who grow up in the setting of Norway. And I think as parents, we have our traumas, as you mentioned, but we really need to be open about it and seek help, because if we don't seek help, then we are not in place to help our young people. To be able to talk to them about it and to be able to see the signs that they might be showing us, but because we have our own issues, we are not able to see. So I just mentioned some of the signs. It won't be like a common thing for everyone, but these are some of the signs that we see in patients or people who have tried to commit to take their lives, but who have attempted to do that. Like making suicidal statements. You have mentioned, Juliana, you had a friend who had written about it. Some people were intentional about it. They can make some suicide statements or leave letters, so we have to really be observant about it. When people talk, when people who have had some issues start talking about taking their lives and stuff, we should really take that as warning signs, and if someone is preoccupied about death in their conversation, either by writing and drawing, people who work with children or at school, when children draw things, as children's child psychologists, many people would understand from the drawings of children what they're trying to say. So it's very important that teachers or people who are working around children are very observant on the drawings that children draw or what they even talked about in their conversations, because those can be signs that can be picked up. And giving away possessions or belongings would also be a sign that someone is kind of, trying to give a sign that life doesn't matter anymore. I don't need these things. I need to move on. Or withdrawing from your network, withdrawing from your friends and family, or for young people being aggressive or having a hostile behavior, starting drinking, behavior that they haven't been indulged in before. Suddenly someone picks up a behavior and become aggressive. Or neglecting personal appearance, someone who has really been very, careful about the way they dress, trimming their hair, and keeping good appearance, suddenly starting not to take care of themselves or their personal appearance. That's a sign that something is going on. Not necessarily trying to commit suicide, but something is going on. So it's very important that we take those signs. Or even maybe running from home. and if a parent or someone is trying to set boundaries, they run from home, or these can be signs that something is going on. So as parents, we need to be there to see these signs. And if we are not there, then we are not able to pick up. Reckless driving or being sexually promiscuous can also be one of the signs that we should be asking questions about. Severe sadness or moodiness, suddenly, the mood swings, someone is sad and suddenly getting into deep depression. That could also be a sign of something. Or hopelessness, a feeling of hopelessness, that life doesn't matter, nothing's getting better, things are just going down the ditch. This is also very important for us, people around, to be able to talk about it. Sleep problems, people, don't sleep, and then you start having thoughts that are not good, and, nightmares, or maybe also resulting into not concentrating at school, and even the grades at school start dropping. That could be also signs to look at. And also sudden calmness, someone who has been talkative, someone who has been very active, engaging, suddenly becoming calm and getting into depression or withdrawing from things that they really love to do, things they really are so much engaged to. This is also a sign that something is going on. We should be careful. We should be there to ask, dangerous, harmful behavior, I've mentioned that. And also in maybe recent trauma, suddenly you lose someone who's very dear to you, you lose a child, you lose someone precious to you. It's very important that we get the help, the psychosocial help right there, because these are crises that can, when left unattended to, can start developing into mental health problems and even suicidal ideation. Making preparations, I mentioned that earlier on, or threatening to commit suicide. This is very important to take it as signs. And our presence as grown-ups, be it parents, be it friends, be it teachers, whoever is there, even, like in the Western world here, the police are kind of, they go through some courses on first help, suicidal first help, to be able to notice this sign. So I think it's very important that people who are working either with children or have these important positions in the society are trained, even community leaders, even religious leaders, to be able to see those signs. Thank you.
Thank you very much for that very, very comprehensive list. And I want to pick on one that you mentioned, which is substance abuse. Every time I come to Juba, I always say that there's a drinking problem in Juba. A lot of people, we are abusing alcohol, and it's not just older people. I see very young people. When you start from the airport, leaving the airport, going into the city, there's a huge problem of alcoholism, and this could be a negative coping mechanism for the issue for most of us who have trauma that we have not resolved or addressed, who are having a very difficult time in their day-to-day life. So we resort to drinking. And as Pony has mentioned, this is actually one risk factor. So yes, definitely when you see that someone is abusing alcohol, we take it as though it's a social thing. You meet with your friends, you're drinking, but I think we know when it is problematic, and we know that for many people who are doing it every day, it is a negative coping mechanism, and it is a risk factor for suicide, and something that we should talk about. We have a question from the audience, and I will direct this question to you, Pony, as well as to Thokriel, because you are the social workers and psychologists. The question is, in South Sudan, hate speech is so pervasive, right? And people feel that hating one another is good, unfortunately. How is this related to mental health, and how is this concerning in terms of mental health as well? Thanks. So let's start with Thokriel, and then Pony, if you'd like to also answer the question. Thank you. I think we have Nancy is not available at the moment. Go ahead.
Being in the Western world, it's unfortunate South Sudan, we have the hate. We are a country of 64 tribes, but we still hate each other. Why? God knows. We strive to be a country of our own. That's why we became South Sudan. But the hate still continues. Mental illness is not going to go away. So the hate with that mental illness, it's not a tribal thing. It's not Nuer, Dinka, whatever tribes we are. the Dinka or whatever. It's a mental issue that we have to address. When you see your brother, your sister having mental issues, we have to address it. So that is gonna stay until we address the mental illness. It's not gonna go away. Mental illness is there to stay. How do we do that? We have to educate each other. That is a disease like any other disease, as I had mentioned it, and I keep mentioning it because in the diaspora, that's the one thing when I go to conferences, they seem to isolate mental illness as an issue of itself. But I'm like, and the psychiatrists and the MDs I never mention is that it's a mental illness. It's any disease like cancer. So until we accept that in South Sudan or in Africa, it's not going to go away. So how do we go about that? Let's accept that it's here to stay. But how do we address mental illness as part of our disease? Let's start. That's where the conversation starts.
I'd also like to mention that this is again another thing that we as South Sudanese need to discuss, because we all voted to have this country, South Sudan. We struggled for many years to have this country as South Sudan. But now what we have seen is internal conflict among tribes. Some of them are tribally motivated, politically motivated, etc. So this hatred, we're calling it hatred, yes, but or tribe, whatever we want to call it, is now a driving cause for additional traumas that we are subjugating a new generation of young people to. So it's becoming a cycle thing. So we can say, yes, there's hate speech, but hate speech is causing violence, it's driving violence, and that violence is driving more additional trauma. It's resulting in, we talked about high suicide rates in the IDP, in the protection of civilians camps. This is because that they have experienced that cycle of violence. We talk about recreating. People fled during the war. They came back to contribute to building the country, and they have fled again with
so the cycle continues. The cycle.
So yes, there's this intergenerational trauma. So it's hate speech, yes, but we need to also talk about this and how do we come together as South Sudanese to try to build our country and not to destroy our country. Pony, would you like to answer the question as well?
I think you have covered it very well.
Okay.
Yeah, so, yeah, thank you.
Okay, I'd like to, I would like to turn the next question to Nancy. I've been really wanting to for her to answer this question, but we've been having some internet issues. She brought up an interesting topic about mental health in the disciplinary forces. And as I mentioned, we have quite a huge army. We invest quite a lot in the military section, but I don't think we ever talk about mental health among the disciplinary forces. So Nancy, if you could lead us in this part of the discussion, I'm really looking forward to hear what you have to say. Thank you.
Yeah, thank you, Dr. And when it comes to mental health among the disciplinary forces, as you said, we have really invested in giving them everything there is for them to go to war anytime, any day. But no one really cares about their mental health. No one really cares about how they are doing. And most of the time, since they are just seated in the barracks, they opt to go into alcoholism, they opt to engage in an unhealthy coping mechanism. And then there's also the issue of suicide among the military, which is a bit tricky because you see men in uniform or men and women in uniform are supposed to be strong, are supposed to be the people defending us, yet we don't look at them as vulnerable too. So you see, even as the government is planning, it never really until now that they are trying to put mechanism, they never thought that this could be a problem. And like in the US, where you have even veterans put in programs where they're actually even treated for PTSD and other mental illnesses, and they are taken really seriously. But here we just expect them to be strong, to be there to defend the country, to be there to do other things, but no one really is in touch with them in terms of their wellness. The other thing is being in uniform, they're not very approachable because we all have our traumas when it comes to the police, when it comes to the military. So they have no one to talk to unless it's amongst themselves. So getting these services is also hard because it's also a sign of weakness for them. So at the end of the day, we also the society judges them harshly. And the media also highlights on the negative. a lot. And remember, Dr. Kingi talked about suicide
Hello? I hope we haven't lost you. You're raising some very important issues. Just before we get back, Nancy, the difference between, I would say, the significant difference, I would say, between maybe the armed forces in Kenya and in South Sudan is because the armed forces in South Sudan are not just sitting in the barracks. They are being deployed to multiple times, several times, to go and deal with some very significant issues. They are being involved in traumatizing events and situations. And I have never heard of any resources they might have or any discussion about what the effect of being in a constant state in of war, essentially being at the front line, of the conflict that is the multiple conflicts that are happening in South Sudan at the moment, and how this might result in suicide ideation, or might cause some mental health issues, post-traumatic stress disorder, for example, which is associated with having been involved and engaged in war. This, I've never heard it discussed among the South Sudan military forces. We talk a lot about, I guess, regularizing the forces is the word that we use, but we never talk about providing mental health support to our young men who have been, mostly young men who have been engaged in multiple rounds of violence. And we also do not have any idea of what of the rates of things like alcoholism or substance abuse are within the army. I would say that it is quite high, because I have observed it, but I cannot say that we know what the actual rates of it are. Nancy, I see you're back. Maybe you can continue.
Yeah, sorry. At the end of the day, the media is really broadcasting the negatives when these suicides happen, when a person in the military maybe takes his life and the life of his family. And we're not really like looking at them as human beings, as people who are vulnerable, as people who've been exposed to so much. And at the end of the day, we judge them very harshly. So at the end of, I would actually urge the people maybe in the forum to actually even start looking at them as human beings, and start looking at them as people who have feelings. Even when you walk and you meet one, just ask them, how you doing? Just reach out, because the uniform scares most of us. And at the end of the day, they feel like they're isolated and cannot be able to talk to people. Yes. And on the preventive, I would also want to maybe comment a bit about it.
Please go ahead.
Especially, yes, there was a lady there who was wondering what to do with especially with the generational trauma and so on and so forth. I think it's a change of mindset, first of all, for everyone. And when you do it in your house, you kind of even influence change to the young ones and to the people around you at the workplace, where people even adapt to meditation and spending time in nature, doing those peaceful walks, and creating relaxation corners, even at your workplace, in schools, where people can just go and chill out and just have a moment when they are stressed out. And Safaricom, a corporate in Kenya, is known to have these corners in the organization where you can just go and have your moment. And initially, people had smoking corners, smoking zones. But these days we have the relaxation corners where you're able to do that in most of the big corporates. And then we also advise to learn to cope by reading mental health books. Enlighten yourself as far as mental health is concerned. And also sign up for the therapy session. I don't know whether it was you, Dr. Juliana, who mentioned that it is important to have a therapy session, and she wished that anyone could have access to that, which is very, very important, even if it's not for anything, just for personal development, to be able to check where you are at, yes, and get support where you have your, or get highlights, especially cognitive therapy, where they pinpoint your blind spots, and then create a self-care routine. Is it jogging? Is it swimming? Whatever you feel like you do to just distract your thoughts. And also appreciate and have the attitude of gratitude. Appreciate the good things that have happened. Don't just look at the negative. Focus also on the things that have happened in your life that are also good. The other thing is accepting negative feedback and be able to cope with that. You know, sometimes we are told, oh, I don't like the way your hair looks, or I don't like the color of your skin. You know, this person, whatever he's coming from, it's not just about you, it's about him also. You know, those are his struggles, those are his values that are misplaced. It's not about you. So if you're able to separate that, then I think people will do better. Thank you. And sorry for the hiccups.
No. We understand totally. Thank you so much for especially highlighting the issue of the armed forces. You know, they're present everywhere in South Sudan. They live among us. We do not know what they have gone through because we never talk about it, and there's no forum for them to really discuss what they've gone through, how they're feeling. You know, and we know that when you're deployed as a soldier, you don't really have a right to say yes or no. You're deployed and you're sent and you go. And so what that experience results in, we know that there's high levels of violence between soldiers and within families of soldiers. So, and we know violence begets violence and leads to what Dr. calls intergenerational trauma. So definitely starting to think as well to advocate about really having strong, not even strong because we're starting from the very beginning, having a mental health focus that is also for the armed forces, that also prioritizes the armed forces. Dr. you've been silent for a while. So I would like, sorry, Kawach, you've been silent for a while. You've experienced a lot in Egypt, especially around this topic, and this is why it really led you to want us to discuss this, and we really appreciate that. What would you say are what would be your practical advice that you would give to youth who might be going through difficulties that might lead them to want to commit suicide? Question one. And number two, also, what are some of the coping strategies that you know of or that you would recommend for young students in Egypt who are trying to make a better life for themselves, but having all these difficulties that you mentioned before? Thank you.
Okay, thank you. So I would like to tell the youth, like especially South Sudanese youth, that no matter what is going on now, there is a life behind it. It means like we don't need to jump into conclusion that things are like this. I'm sick. You know, I don't have money. I don't have someone to talk to. That should not be the solution, because there is something good about life. You know, challenges are part of life, and they make life interesting. Because you can, you know, every day you are not, yeah, you can feel good every day. That's why they say not every day is Sunday. And we have to think about that, to think that tomorrow may be better. So when it comes to those who may feel like, who are going through, like it is obvious, everyone is going through, especially South Sudanese here in Egypt and back home. They need to seek support. Even if there is no proper support, like there are no parent or no government to support them, they also need to talk to their friends. You know, everyone has a friend. So they need to talk to their friends. They don't need to fear, because fear may lead to different things. They need to tell their friend what they are going through. You know, they should not feel ashamed, because as we have talked about it, mental health is just like other diseases, like just diabetes and hypertension. There's nothing about it. It's just a disease that has a solution. So whenever they are going through a lot, as we are going through a lot, we need to talk to our friend. For example, me, I'm also youth and I'm a South Sudanese. I have my problem, but the way my coping mechanism some are personal and others, and I can advise you that they need to talk to their friend. Talk to anybody the loved one, people you trusted. Tell them that I'm not feeling okay. I'm thinking about this. What should I do? You may be surprised to find out that they're also going through the same thing, and from there you will talk together, sit down, and try to help each other, because that suicide or whatever is not the solution. It's not the solution. There
But
is
when
something.
that's what
Yeah,
the question come in Kawaj, because our
yeah.
people will never talk about suicide. Suicide never existed. Mental health never existed in South Sudan. How do we make that a normal conversation at our dinner's table with our families? How do we talk to our children about that? Because it never existed. You know, how do we do
Yes,
that?
yeah.
That's the step we have to take before anything else.
Of
It has to be the
course.
first.
Of course, thank you. That is the most important thing, because I think we talk about it. Many experts talk about it. Where to begin with is just making awareness, because the problem with South Sudan society, they are not aware of mental health. When somebody is sick or somebody is having issues in his life or her life, people think this guy is mad. They call it madness, which in actual fact there's something called madness, only because they are not aware of it. So we have to start by making them aware. Like, this is our responsibility, especially in this forum. This forum should also try to prioritize this. We can aware our youth, because all of us, we have mothers, we have uncles. So if I'm aware, I can go and talk to other people. We can, through social media, because I know our government, we are going to, we still have a long way to go. If we leave this one into the hand of the government, I think 20 years later, we will still talk about this. Because now the government, I think, is focusing on other things, which I will not go. But this is our responsibility, just to make our communities aware, make our villages.
Yes. And
Yeah.
Dr. Kingi and Nancy mentioned something that I think is really important, that one of the risk factors, and Pony as well, one of the risk factors being that sense of isolation and lack of support. And you've really spoken about it as being one of the main experiences of students in Egypt. And I guess I'm wondering, as deputy of the Awil Association, maybe there are some ways or some ideas that you can come up with to really try to bring young people together, to start to talk about what their experiences are, what their challenges and hardships are. Maybe we can discuss having something similar, a similar forum that we can present with the youth, or you can also direct them to watch this particular video as an introduction to the idea of, or the issue that we've been talking about, suicide and normalizing suicide. I understand that there are not as many resources within Egypt, but maybe this as a resource, as well as if you reach out to us, we could think about ways in which we can have some discussions around mental health and suicide. The next question that I would like to ask is to Thokriel. What are some of the coping strategies or mechanisms, especially for those who are left behind, those who have lost a loved one to suicide, families who have lost a loved one to suicide or friend, and what can be done for families for them to cope as well? Thank you.
Thank you, Dr. Juliana. I mean, suicide attempts or completion, unfortunately, we have a lot of kids in diaspora that have completed suicide. How does family function? I'm a professional in the field. When my nephew did it, I didn't know how to function. I've always told my patients, take your medication, do this. And when it happened to me at midnight, I hear the popping gun sound, because that's how he took his life. And one of the psychiatrists like, have you been sleeping? I'm like, no, I don't need medication. And he's like, but that's what you tell your patient. So I have to stay back and realize that what I was preaching to my patients is not what I was practicing. So I, do what I say, but don't do what do what I do. So I have to take medication to help me sleep, because I didn't sleep for days after midnight, because that's when he took his life, was at 12:05. So every time after 12:05, I'm cleaning, cooking, and my husband's like, "Why are you up?" And I'm like, "I can't sleep." But I was afraid, because that was the gun went off while I was looking for him when he took his own life. So I had to accept that I need something to help me sleep at that time, because that's how I was coping with it. So how do we cope with this thing? We are in denial. When I did this at South Sudan Unite, it was me and my niece went into it. Nobody accepted that. By the time we finished the conference, we had 14 plus family members that have lost their loved one to suicide. Why? Because we don't address it. Until we start addressing this as South Sudanese, there will be no step. We won't make it anywhere except we address it. So how do we deal with that? I'm talking as a professional. I struggled dealing with my nephew. And the saddest thing, his birthday was October 2nd. Oh, no, my birthday is October 2nd. His birthday was October 3rd. We used to celebrate it every year. And then having to celebrate the first birthday without him was the hardest thing, you know. But then on top of that, my sister, my brother-in-law, they've been blamed by the community. It's unfortunately he took his life, but it wasn't their fault. So we need, as a community, we need to stop blaming the parents, because it wasn't the parents' fault. It was whatever happened, and it was because we never addressed it. As I mentioned earlier, there's intergenerational trauma that we need to address. Until we address that intergenerational trauma, we're not going to fix the trauma right now we live in. So community, you need to stop blaming the parents, because it wasn't the parents' fault. My sister and my brother-in-law are living with that guilt, being blamed, the shame, the humility, and all that comes along with. They've never been the same since that happened, 2017, December. Why? Because we are a community. So what do we do as a community? Instead of blaming them, instead of just going and bury these children and leave and then move on and start talking about these parents at the funeral, maybe we don't need only your financial support. We need your financial, emotional, and physical. The financial you give, the emotional, be there for these families. Physically, come and visit them, talk to them, and see what could we do for the next generation not to kill themselves. What do we do as a country, as a community, as a South Sudanese? What do we do? It doesn't matter what tribe we are. 64 with South Sudanese. I'm a South Sudanese. I don't consider myself Dinka, but I consider myself a South Sudanese. What do we do to this? Instead of pinpointing at my sister and blaming her with my brother-in-law, how do we come around her? How do we support her so that my next nephew or niece or the next child doesn't do the same thing? How many kids have jumped off the bridge in Iowa or in Canada? We found them dead. But what do we find them? There's intentional suicide, and then there's accidental, but it's all suicide. So how do we help these communities? So until we help each other as community, don't blame the parents. Parents came here to give the best life for their children, but they didn't know how to do it. These children are born in the United States or Canada or Australia, but they don't know how to live. So we're living with 3 generations in one house, but they don't know how to take care of each other, or they don't even know how to understand each other. So how do we let them understand each other for us to create this new norm they have? Don't blame my sister, don't blame my brother-in-law, don't blame any South Sudanese mother or father that's lost a child to suicide, because they didn't know better. But how do we educate each other so that we can raise this new generation and bring them back to South Sudan? I have 4 children, beautiful children, but how do I bring them back to South Sudan? That's my question to all my South Sudanese people. How do we do that? So first of all, is be supportive. Don't judge, don't blame, be supportive, talk to them. Financially, yeah, you can financially support them, bury them, but just don't leave and then go your own life. They still need you. You have to physically come and visit them, talk to them. So it's emotional, physical support that we need to take them home, to take the whole families back to South Sudan if we want to be a country.
I think you've mentioned something I didn't even think about, the fact that, some people would blame the parents or the friends of the person who has committed suicide, as opposed to really being supportive. And I hope that for everyone in the audience, that this is something that it's a very simple thing that you can do when you know of someone that has committed suicide, which is, as Dr. has said, not to blame, but to try to find ways in which to be supportive. And being supportive can be as simple as just being available. to talk or just to sit in silence with that person. It doesn't have to be anything extreme. Nancy had mentioned some very practical steps like exercising, walking, or jogging. So definitely assigning blame to people who are already feeling guilty about something like this, you're contributing or compounding the problem. And I hope that for everyone, if this is something that you come out with, leave with, number one is that we all need therapy, and so we should all be thinking about ways of getting it. And number two, that blaming people is definitely not the way to go. Ms. Pony, if as a social worker, I'm sure this is an area that you have been involved in as well. If you could also let us know, what is the effect of suicide on the family, the affected family that has been left behind, and also what are some of the things that can be done to support such families, and thirdly, if you have any recommendations for coping mechanisms as well. Thank you.
Well, thank you so much. And again, thank you, Topriel, for sharing your experience. And it's really painful, as you say, when families have lost their child and again get the shame and blame. So it is a difficult mourning process for people who have lost someone to suicide, because again, survivors of suicide loss, it is devastating, to lose a member of the family by suicide. So they need the support of the people around them, and they need also psychological help, maybe just to talk about this issue. But again, because our community, because it is a shame, because suicide is a taboo, because mental health, we don't talk about it, it becomes difficult for people around to even support this family in an adequate way. So we really need, as Tokia said, in a community to talk about it, to be open about it, so that we can be able to support our people, our families who have lost people to suicide. And again, with that blame, because already the families that have lost someone to suicide, they're already thinking of this. What are the signs that we could have, looked for? Are there signs that we have kind of ignored? What have we done? What role have we played? Yeah, they're already blaming themselves a lot. So by, again, not supporting them makes it even difficult for them. It is difficult mourning someone who has died of cancer than someone who has died of suicide. And again, it's because our community is not open to talking about mental health and the issues that come with it. So it is not, it's very important that we do not blame the people that have lost someone to suicide, or even the person who has died, but to give the support that we need, because it's really a tough thing. Most people experience that, because people don't know how to talk about it. Suddenly they are left alone, you don't get the support that maybe you are not being visited. And young people have experienced that, especially the ones who have attempted suicide but have failed. So when they come back to school, they feel like they lose friends. People are not careful about being around them. Teachers don't expect so much from them, because they feel like it's not someone has a problem, maybe they are not going to live up to some expectations that the teachers set. So it is important that people around are educated about it, and how to meet people who have tried to commit suicide but have not succeeded, and are trying to come back to life, that they are not stigmatized, that they're not shamed on, but they're supported, so they'll be able to have that hope of maybe living further life. But then again, for those who have lost someone, that they get the support that they need to be able to move on, because it's not easy at all. So it's very important that community awareness, it's very important. And again, having a language, because again, we don't have a name. I don't know in my language in the Bari if there's a name to mental health or suicide. And if we don't have a name, then we can't talk about it in a way that we'll be able to express our feelings about it. For people who have lost someone to suicide, it is individual. It's different. I don't have like what do you call it, an answer to everything. But I think it's important that the support of the family is important, but also finding ways to be able to cope with this thing and getting professional help, because it is a trauma to lose someone, and you need the help to be able to talk about it first and mention it. I work with immigrants, and again, because also it's a taboo in many immigrant communities. So sometimes people also, it depends on how the person has lost their life by suicide. But in some instances, people have denied or not mentioning, not saying even it's a suicide. So it becomes even another difficult thing to talk about it. They cover it up by saying maybe it's some disease or something else. So if we don't talk about it openly, it becomes also difficult to heal, because then you have not acknowledged it, and then you'll not be able to heal it. So it's very important that we acknowledge it first and then find ways to be able to heal from it.
Thank you very much for that. Recently, one of my work colleagues actually lost her husband to suicide, and he did this in the home when her and and their son was there. And I cannot even begin to imagine how you move on from something like that. As I mentioned, my friend who committed suicide a couple of years ago, um, and I have lost a friend to cancer, and I can say that there is a slight difference between someone dying from a disease like cancer, because the doctors have tried everything. My friend was really fighting for her life, and so at the end, it was something that was external to her that happened. With suicide, you know until today, I often think about, is there something I could have done differently? Could I have called sooner? Could I have gone to see her? Could I have said something, reached out the night before? So there's that additional
The
element
guilt.
of guilt, and also feeling responsible for what happened, because it's actually suicide is actually a choice that someone makes, right? And if they're successful, it results in the end of their life. And so for people who, and I'm aware also, Kawash, this is something that you might also have undergone, in the sense that you probably do think about how you could have been more supportive, said a different word, done something differently. And this is different from, if someone dies of malaria, for example, we don't have the resources or the skills to actually manage or treat them. But we always think in terms of, we could have, should have done something different. I cannot imagine a parent losing their child and then having to deal with the guilt, the constant reminder of what could I or should I have done differently, and then having to face a community that is blaming them. So um, very difficult things to discuss. Nancy, as a psychologist, and being aware that there are people on this panel who also have, um, you know, been affected by this, what are some of the coping mechanisms you would recommend for people who know of someone who has committed suicide, for families who have experienced this? Yeah, what are some of the coping mechanisms that you would suggest and recommend? Thank you. I really like the practical, very practical nature of what you mentioned when you were talking about the disciplinary forces. And yeah, thanks.
Yeah. Okay. Okay. Thank you, Doctor. The first thing I would like people to understand is the 5 stages of grief. Because when you don't know where you are at, you don't know what to do. The first stage, they are not in order. Grief is not linear. When you lose a loved one, be it to cancer, be it to suicide, the stages are the same. And they can play out and even come back anytime, even when you think that you've processed. The first stage is denial. Right after shock, you just maybe are expecting this person to still come back, or you're looking forward to meeting them, yet at the back of your mind, they're dead, they're no more. Then there's anger. As reality sets in, the person feels deep rage towards themselves or others who they may perceive as having caused the situation or having not done enough. This anger can actually be directed to yourself as a person who's mourning, like you didn't see it coming, like you should have done something, like you should have made their life happier. Especially when it comes to suicide, it's difficult for family members. Then there's bargaining. The person's anger, now the person grieving, turns to begging, possibly to another person or a higher power, for the loved one to be saved, for him to at least come back and they do things right. Then there's depression. When the anger and the bargaining not having any effect, the person feels immense sadness at the sight or prospect of losing the person who died or something that is very dear to you. And then there's acceptance. Acceptance is very ideal. Like after grief, we all want to accept that this person is no more, it was not our fault. But then again, it doesn't happen in a day or 2 years. No. no one can give a timeline to grief. So I want to stay with people who've lost a loved one through suicide. The guilt is too much. Because you know what? As human beings, we feel like we need to make our relatives, our family members happier. There's something we can do to uplift their emotions. But then again, this is an illness, just like any other. And there's nothing you can do. So the first thing you need to do is deal with the guilt. Self-talk. Tell yourself it was not your fault. Because you can't tell when someone is having issues unless they are able to share with you. Because if a family member, I believe, shared with me, I would have maybe looked for support elsewhere and linked them to it and maybe followed up. But if they don't, what else can you do? And even some, I've seen families where people were even in therapy, but yet they still committed suicide. So the family had actually even supported them as much as they would have wanted. So first of all, we have to demystify societal norms and be able to deal with the loss as just like any other. And to get there, then you have to understand where you are at with the stages of grief, as I have explained, so that you also know that it is important to talk to someone, be it a colleague, someone you trust, be it a neighbor. I won't just say therapy. You can reach out even to a spiritual leader who'll be able to give you guidance on where you are at. But ideally, therapy would help, because therapy would actually say you set goals with your therapist and you're able to move from one point to another and come up with solutions on your own. They're just there to support you. And the other things that not just people dealing with grief, but in every one of us needs to find coping mechanism in every situation. And like now, if I asked, when you have pressure at work, how do you cope with it? And if you don't know, you need to reflect more on that, because some people eat too much, some don't eat at all. Some people like punching walls, which is not healthy. When like your boss is telling you, you've not done this, you've not met targets, yet you tried your best. So we all need to establish healthy coping mechanism. And initially I talked of jogging, swimming, things that makes you, things you like doing that makes you get a bit tired, that when you go to sleep, you just sleep automatically and you're able to rest well. And that is re-energizing. And when you re-energize, you're able to focus better and concentrate better, be it in school, be it at work, or even dealing with family issues. And the other thing is embracing positive self-talk, affirming yourself, be able to tell yourself that you did enough, you're good enough, you're worth it. That is very, very important to keep reminding yourself. And then a healthy self-care routine. Some people like the happy hour after work. Just go take one beer or two and have fun, dance a bit. That is very healthy. You're able to unwind. And the other thing is breathing exercises. Being able to, when you're stressed out, and other people embrace yoga. Yoga is very relaxing, but not everyone is able to do yoga. You can just sit and breathe in long breaths and all that, and be able to. And these are things that are actually even on YouTube. You can be able to get the videos and be able to learn how to do it. The basic things that you can embrace. The other thing that is very, very important is journal. Keep a journal. Whether it's for happy moments, sad moments, a journal always, it's very therapeutic. And join a support group. People with common, people have gone through common experiences, and you're able to share about it. This is not just for Alcoholic Anonymous. Even for therapy, we have support groups for people who've gone through various issues, and we put them together, and they're able to support each other, deal with situations better. The other thing is being able to reach out and stopping this stigma thing, because if you know a family that is dealing with loss due to suicide, I think just reaching out is very important, because most people will be judging them harshly. So you can, I always say, be the change you want. So reaching out, be able to talk to them, be able to be there for them, or just sitting there with them without even saying anything is very, very important. That's it from my side. And thank you for the opportunity.
Thank you very much for that. Definitely some very practical advice that we can give. I definitely started journaling when I lost my best friend a couple of months ago, and it is very helpful, even though all I write are how angry I am and how the world is a terrible place, but it really helps me process my thoughts. So, Thokriel, maybe you can talk to us about coping and dealing with guilt. And then as we are winding down, if you have any recommendations that you would like to share, as well as any final remarks that you would like to share, if you can do that within this period of time as well. Thank you.
Thank you, Dr. Juliana. Guilt is, I think, going to be the biggest thing I still have to deal with, because my nephew came from Minnesota to Texas Friday before he took his life. I was with him all day. They always say, whoever wants to take their life, you're never going to see that side of them. They portray the best of them. And he did. I was with him all day from 9 in the morning until 10 at night. And then at midnight, he took his life. I didn't see that. That's the guilt. I have saved so many lives working in the system, but why could I not save my own? And that's the guilt that I live with every day. And one of my psychiatrists says, Gabriel, I've been in the field for over 35 years. I've not saved a life. Maybe I have, but you can't live with that guilt. But why? Why not my nephew? Why could I have not saved him while I've saved thousands of lives? Is it I didn't ask the right questions? Was it that I didn't see the signs, which they hide it very well? If they want to take their life, they will hide it from you the best they have. And so as family members, you have to pay attention to that. How they're behaving, how they're talking, how they're laughing, how has anything changed in their behaviors? Because that's the first thing you have to know, their behaviors, because they will change, because they will portray the best they have. And then they will finally take their life, because research has shown that anybody that wants to take their life, they're not going to talk about it. The people that will say, I'm suicidal on this, then they ask for help. But the real people that are going to carry it out, they will not. He did not show any sign. If anything, showed me the perfect sign. We went to the mall, we shopped, came home, laughed, ate dinner, everything until 10 o'clock, 11. He goes to his room, I go to my room. Then he leaves and leaves a note. He left a 2-page later. And so that guilt as a professional, how the hell did I save lives, but I couldn't save my own? I'll go to the grave with that answer. Nobody answered that question to me. I went through counseling, and I'm still going some days. I had to take medication because I refused, and my psychiatrist said, don't you preach to your patients to take medication, but you're refusing? Because at midnight, I can't sleep because I'm hearing the gun pop, and I'm cleaning and cooking at 2 in the morning. I need to sleep. And my psychiatrist said, what? You need to sleep too? So I was telling them what, but I wasn't practicing, so I had to accept that. So we have to accept the reality of things. We ain't functioning well. I ain't functioning well as a professional in this field, but I have to each day live with that guilt. I don't know when I will answer that. Maybe when we have talks down the road on this panel, I may have a solution to how I function, but I am here tonight telling all the South Sudanese, listen to your children, pay attention to how they behave, how they talk, because we are different generations. My mother's, my grandfather's, and our children are two different. We're all different. And trauma is intergenerational trauma. I'm working on my PhD, and I'm looking at intergenerational trauma, how it affects people, because it does affect. They may be born, I have 4 children born in the United States, but the trauma I experienced from my parents' parents is still going on. So how do we do that? How do we stop that trauma? And how do we fix this trauma that we have? Or else we came to America, to Canada, to Australia to save these children, but we are burying them. We're taking the casket back to South Sudan. How do we stop that as South Sudanese people? Until we acknowledge that, until we accept that that's an issue, we're going to bury all of them and take them back in caskets back to South Sudan, or bury them in the United States or Canada or Australia. How do we do that as a community? As I say, I'm a 64 tribe. I'm not a Dinka. I'm a South Sudanese. How do we do that as South Sudanese to take back or to save this generation? Because we are burying our generation. Mental health is here to stay. It's like any other disease. So as a professional in this field, let's acknowledge it. Let's educate each other. It's a disease like any other disease. And then what's next? How do we save this generation? Let's talk as family. Okay, we have issues. How do we do that? Let's address it as family members. Most of us haven't addressed my nephew's death because we don't know how to do it, because we were never taught how to address it. I've made it a point in my life, I will address it as my part of my healing, because grief is a process and we all go through grief in different ways. I haven't grieved from my parents' death. My dad will be 30 years next year. I haven't still grieved with that. But how do we do with grief? It's stages. By my grief is to educate South Sudanese that suicide is here to stay, and how do we do about that? So I have decided to speak to grieve my nephew's death because he did it in front of me. I heard the gun pop go off while I was on the call with 911. If you're in the diaspora, there's 911. You can call that and they can help you. Take your loved one to the nearest emergency room and I will see them, or any other professional will see them. If you're in South Sudan, unfortunately, the South Sudan government needs to enforce those things. And that will be the part of recommendation where we recommend a crisis line, a task force, mental health task force with professional training that are not going to judge you and ask you questions that are judging. We have to address this as trauma-informed. As I said, earlier we would say, my nephew committed suicide. No, he died by suicide. Because when we say committed, it's a crime. He didn't commit a crime. He just took his life. So he died by suicide. That's trauma-informed language. So we have to use that language in the first place. So we have to train these people. So South Sudanese government has to enforce that, a crisis line, because our kids are dying. Educational. We have to educate. Mental illness is not a stigma or taboo or anything. It's a disease as anything. Why do we go to the doctor because of cancer? Why don't we go because I have mental issues? I'm hearing things. That's not your neighbor bewitching you. That's what I was told until I realized that's a mental illness. It wasn't my neighbor doing that. And then I became intrigued and became a mental health specialist because of that. So education is the first key recommendation for South Sudanese government. Let's educate our grassroots. Let's educate these people. Mental illness is not a taboo, but it's a disease like any other medical issues. Once we educate each other, then let's support each other as a community to help each other. Don't judge, don't blame, don't talk behind each other back, because anything can happen to anybody else. But be a family as one, and let's support each other.
I really appreciate the consistent message that we have been receiving from Thokrial, which is we need to speak about this issue as communities. We need to be open about it, and we need to address it now because it is an issue that is affecting all of us. And I appreciate also the fact that she has said we need to stop shaming other people who have experienced this. Kawach, maybe you can also speak to us about what recommendations you have to make and any conclusionary remarks you might have. Thank you.
Okay, thank you, Dr. Juliana. So my conclusion is, as a solution to our problem here in Egypt, because, about South Sudan, I think government us will do something, but it's specifically about the situation in Egypt. I think, there are so many South Sudanese here in Egypt, and 1,000 of them, approximately around 7,000 students brought here under the scholarship. There is a scholarship here, which is not, to me, I want to recommend that the government should at least look into this scholarship and do something about it. This is just my suggestion, and I think this will be the solution, because so many students are brought here, without any support, and this is so difficult. And our government should do something about this to look into this scholarship, revise it and see the negative side of it. Because to me, I think it is good, but it comes with a lot of difficulties in which we are experiencing such a thing like suicide and other things. So this is my recommendation, and I will also conclude because I can see the time is going. I would like, the forum, this South Sudan Women Intellectual Forum, another forum, to discuss, not to leave this and like as we discuss
I'm
it and
sorry.
leave it like that. We need
Hold on,
to do.
Kawach. I understand that there is an issue with the sound. Aisha, can you hear me? Not sure. Aisha, can you hear me?
Oh, sorry.
Yes. Kawach, maybe try to speak again. Let's see if we can hear you. If the audience can hear you.
Okay.
Go ahead.
Thank you. Thank you. Yeah. What brought South Sudanese, many South Sudanese, especially students here, is a scholarship. I think if you people, I don't know whether you are aware of that scholarship or not, but many people are aware of it. This scholarship need to be revised by the government. The government of Egypt and South Sudan government should look into this scholarship, because I think this scholarship is causing more harm than good to us, according to what I've seen. And for those who have information about it, they will take it from there, because the government must do something about it. And to conclusion, I would like to conclude by saying this forum is very good, it's doing well, but I also recommend the forum, to talk about issues like this, because I can see I have been an active participant of this forum. I used to watch all the live videos and so on. And the forum or the leadership need to engage, the decision makers in our country, because they need to be invited here and we talk about these issues, because these are very important issues. A country cannot move ahead without all this. It will never happen. We need to engage the leadership in our country to do something about it. Like now, as we have been saying, there is no funding. There is no plan about mental health, no what. In a country like that, this is that good. Government should even prioritize this issue. But now it is left like that, left to us to talk about it. And for us, we don't have powers, So we need to engage the leadership in our country to do something about it. And we also need to do our part, as individuals and organizations, to try our best, because our people are dying in bad and alarming rate, which is so bad to me. I'm so disappointed, but we need to work together as a nation, to push these important agendas, because we can't move ahead without all this. So
Thank you very much for that. And definitely speaking about, let us not just send students abroad without thinking about, and paying tuition without thinking about how they're going to pay for food, shelter, and clothing, and buy books, because that is part of the challenges that Kawash has been talking about throughout, that there's a lot of stressors of living in Egypt that are in addition to trying to get an education, but also trying to just survive. Pony, if you have some recommendations you would like to make, as well as some final remarks that you would like to make, this is the time. After which, Nancy, please jump on when she's finished. Thank you.
Thank you so much, Dr. Juliana. I think, as a collective responsibility, we need to raise awareness about mental health, the stigma tied to it. We need to break it. And as I said, we need to have a name for it. We have to name it, because what we can't name, what we can't talk about, we can't, find a solution to. So we really need to do that. And on a, governmental level, we need to have programs that would help to eliminate the stigma attached to mental health, and also programs that will be able to educate the public about what mental health is, where to go for mental health counseling when one needs that. Resources have to be in place to be able to help train health workers, to be able to have the education and be able to meet people who are in need of mental health counseling. We need community-based counselors, because we are a collective, we are a communal society. We usually solve our problems within the community. So we need counselors that are trained, trauma-based, care, so that they'll be able to meet the needs of the people who might show difficulties in different areas of life and are at risk of suicide. So we really need that in place. We also need to recognize the value of social workers. I'm not sure about the social workers schools there, but really social workers are an important part of the big thing, in addition to the health workers and other like teachers and other professionals. So we really need to educate them in regards to mental health, how to be able to meet the needs of the people. As we talked about, war has really traumatized us. There are people living with traumas that are not being healed. This, as Tropiel said, generational trauma. So we really need to work on this issue, and we can't do it alone if the government doesn't kind of set resources on that and take it as a priority. And in regards to also, that September the 10th is the World Suicide Prevention Day. So it's my recommendation that, the government or even the different services, the social work services or the mental health or the health services, take this day, to celebrate it and to raise awareness about it, that even individuals can organize it in groups, that we on that day talk about mental health, so that we will be able to raise so much awareness about it, and people who have issues about mental health or have maybe suicide ideation will be able to come out and feel like, okay, now it's open to talk about it.
Acknowledge.
Yeah, resources have to be, allocated for research. I'm really glad to hear that Tropiel is writing a PhD on that. That will be a resourceful thing for us to work on. So thank you so much. And there might be many other people there out who are really also trying to study mental health and be able to find. We need statistics also on how many South Sudanese have really died by suicide, and we'll be able to look at those also. We need to have, as individuals, we need to ask direct questions. We shouldn't be afraid to do that. When we see signs of it, we should ask direct questions. Are you thinking of ending your life? And that could be a relief for someone who's really been carrying this burden of, thinking of ending their life. So finally, someone has asked me, and I can be able to say how I feel. So we shouldn't really be afraid of asking those questions. And we also need to work with the uncertainty of living, because if you have stopped someone from dying, so you need to help that person to talk about, okay, what are the hopes? Why should I live, or why not die? So we need to have people who can be able to talk about this issue. What are the uncertainty of living or dying, to be able to do that? So we need also, the last one I'll say, is to create and implement a plan with the person who has attempted to commit suicide, so that the goal of living would be, meaningful. It's not just, okay, I've stopped it this time, but what do I do next time? So this would be the recommendations for now. Thank you.
Thank you very much. Nancy, maybe you can give us some policy recommendations, as well as, specific things that we can do to start to think about mental health in South Sudan. Thank you.
Okay, thank you very much, Dr. Juliana. The first thing, I would like to challenge you people in the diaspora to lobby for more grants on mental health, especially in Southern Sudan, because of what people are going through. You've heard of someone talking of the generational trauma, and I'm sure she's not alone. Because of the war and the crisis now at the moment, I can only imagine the situation, the mental situation in most people, and especially those who are not even able to leave the country, and the children they are bringing up, and so on and so forth. So the grants will be able to help the people at the at community level, where you're able to even now bring in what Bonnie was saying, the community-based counselors who are able to support the community where needed. And the other thing is also using the media to influence change of mindset as far as stigma is concerned. Because if we deal with stigma, people will be able to come out and talk about how they are feeling, what they are thinking about, and that will be actually preventive. The other thing maybe is for local leaders to also talk about it, the political leaders talk about it like it's any other normal illness, to just remove it from the word taboo. Like mental illness is taboo, and it's seen like any other illness, like diabetes, like hypertension, or any other illness. The other thing maybe that would really help is creating solid community wellness programs. These are programs that people are able to reach out if in case there's a suicide. How do we now talk about it? How do we reach out to age mates of this particular particular person? How do we reach out to their parents and support them? And then now that will also help anyone else thinking of the same, and be able to reach out to them. And if one can be able to afford, reach out for services. They are there, be it in Nairobi, be it anywhere, virtually. Because of COVID, sometimes I say COVID sometimes made us even think outside the box, because now we are even offering virtual sessions. I have several clients in the southern Sudan. I have even some even in the Khartoum. So it is possible to reach out and be able to get these services because they are there. And now from now that the social work kind of aspect is now, how do we fund these particular services? How do we fund people to get these particular services? Yeah. And concluding, I would like to say, I'll use a very popular mental health phrase: it's okay not to be okay. You're not alone. So kindly reach out, kindly be able to actually know that people go through this. Anyone can be depressive. It doesn't have to be people from a particular tribe, people from a particular race. Anyone is prone to this. Reach out, be able to know that you're not alone. Thank you very much.
Thank you very much, Nancy, and thank you so much for your time here. Pony, I will give you 1 minute. You had one additional recommendation to make, after which I will conclude.
Thank you so much. No, it's about the use of social media, especially on young people, because many young people have actually been kind of motivated or kind of inspired by things they've seen in movies, things they've watched on social media, or someone taking their lives in social media, and that has kind of initiated them to do that. So as parents, it's very important that we also watch what our children are watching on the social media. And also as grown-ups, South Sudanese, we have this tendency of sharing videos on social media that are really, very in the violence in it, and it could also, if someone is going through a lot of stuff, and especially we us being in diaspora, sometimes you just get a video on WhatsApp and you open it and it's so graphic. So we should really take that responsibility as grown-ups, not to be sharing videos that are really so graphic on social media, because you don't really know the recipient on the other side, what mental state he is in, because this also can trigger things. So really we should take that responsibility of using social media responsibly.
Thank you. And to add on to that, also just being on Twitter or on Facebook, you see a lot of hate messages being thrown back and forth. So Twitter can be, or Facebook, or just being on social media can also be a trigger for people who are experiencing suicidal ideation, because people say anything that they might never say if you are standing in front of them, because they have that anonymity that social media gives them. So as Pony was mentioning, it's not just the sharing of graphic videos, but also young people being really aware of how much time they're spending on social media and the effect it has on them. Even seeing a lot of people put on Facebook pictures of how happy they are. It could be very isolating to see that everyone that is your Facebook friend has a very impressive life and they're very happy, because nobody talks about how difficult the challenges they're going through. So being aware of the effect of social media on ourselves and maybe taking a break when possible is very, very important. I want to thank everybody that has been on this panel. I have learned a lot, and I really have appreciated being part of this discussion. Thank you so much for all your time. Thank you for sharing your tips, your hints, your recommendations, your experiences. I believe that the audience has learned a lot. I believe that the audience has learned a lot from this, as I have. And so with that, sorry, I have a bit of an echo. But with that, the last thing that I wanted to say is that as we wait to have programs, resources for mental health, one of the things we should be doing as individuals is that we should be better friends to others. We should be more supportive to others. We should be not just hanging out with our friends and not talking about the things that they are going through. We should be doing that with ourselves, within our friendships, within our families, and within our communities. Because by doing that, you never know how that will affect someone. just going to drink tea with somebody and talk about openly what your challenges are, how you're addressing them, problem solving with others. And if we can then extend that to not just our friends, but to other people. If you hear that somebody has committed suicide, your first thought should be, how can we support this person? Not just financially, as Tokriel said, but also emotionally. If we don't have the skills, Nancy mentioned that we should be reading books about mental health. Let us try to get those skills. Let us try to find ways in which we can really walk people through the stages of grief that we have just learned about. And with that, thank you so much for your time and your patience in this with this discussion. We hope that you have learned a lot. We hope that you take what has been said and take it one step further to those around you, so that we can start to really bring change within our communities. We have this series of recommendations, and as South Sudan women intellectuals, we will think about how we can progress and move those forward, because we don't want to just have the conversation stop here. We want the conversation to really move forward. So that's something that we will think and plan to do. For Kawach and the students in Egypt as well, we will think about how we can support the students in Egypt in this specific area. And maybe we can work with some of the psychologists that have been part of this panel to see how we can also be supportive. As Nancy has said, there are resources now that are online. There are resources that you can read. So please, if this is an issue that is affecting you directly or indirectly, there is help out there, and you should reach out.
And especially if you're in the diaspora, you have those resources.
And if you're in the diaspora, you have those resources. A lot of times they are free. Let us use them. And for those of us in the diaspora, please tell our families, tell our mothers, our fathers who have experienced significant trauma, that it is not over. You know, we all do need to go and speak about what we have been going through, so that we can start to address them, and so we do not pass them on to the next generation. And with that, I think we can conclude the show. This has been a really good discussion. I've learned a lot. Thank you, and have a good evening all.
Thank you.
Thanks.
Goodbye, everyone.
Bye all.
Bye.
Is it over? Is it ended?
No, it's not yet. We shall leave.
I don't know how to end the.
I don't know how to end the.
I think you will need an assistant.
Is it ended on Facebook?
Is it ended on Facebook?
Oh yes.
Not yet.
Oh yes.
Aisha said yes.
Aisha said yes.
I think it's ended. Aisha, did you want us to?
Aisha, did you want us to
remain or? I think we can end here. I am putting my contacts in the chat. So you can reach out to me at any time, and my phone number as well. And with that, very nice meeting you. Thank you for participating. Let's keep in touch. Yes. Or my personal email is nidamu@gmail.com.